Osteoporosis is a very important disease to know about since our population is aging and more patients are at risk for fractures. And that's really what osteoporosis means. You're at risk for a fracture, and that's what we like to prevent. So it's a preventable disease. Fractures can be very devastating. If one is older, maybe in your 80s or 90s, and if you have a hip fracture, that could land you into the hospital and could decrease your functional status. Let's say you're able maybe to just generally walk with a cane, and after a fracture, there's a high risk that you're going to be wheelchair bound. Well, that's not a fun topic to talk about, but with appropriate prevention, we can help you not to get into that position. Osteoporosis is a disease that does not have any symptoms unless there's a fracture. It's almost like a cholesterol problem. If you have one, you find out too late when you have a stroke. You wish you had done something earlier in life. And here with osteoporosis, we have an opportunity to find out that you have it by doing bone density testing. This will give us an indicator if you have osteoporosis or not and how severe it is. And we can also use the bone density testing in the future to monitor any kind of therapy. Let's think about the causes of osteoporosis. Most often it's in women after menopause, but also men can get it just at a later age. And for example, men that get treated for prostate cancer with anti-hormone therapy are also at high risk for osteoporosis. There are lots of causes for osteoporosis. The biggest one that you also need to remember is being on prednisone therapy. Once a diagnosis of osteoporosis has been made, we have to think about treatment. Some patients with osteoporosis actually do not need treatment yet. Those are especially younger people that should first rely on good nutrition, calcium intake, vitamin D intake, and healthy exercise. That is always good at any age. But if the risk for fracture is sufficiently high, your doctor may recommend you take treatment for this. The biggest category of medication used nowadays for osteoporosis is the group called biphosphonates. You may remember certain names like Boniva, Fosamax, or Actonel. Some of these products are also available nowadays as intravenous injections, but most people are able to tolerate the products just taken by mouth once a week or sometimes once a month. Other treatments possible are sometimes estrogens, although advising about estrogens is much more complicated now because of the risk of breast cancer. There's also a product called Miacalcin, which is a nose spray. There are products that are lookalike like estrogens that are sometimes used in breast cancer that may have a positive effect on osteoporosis, like Avista or tamoxifen, and sometimes they are used also for this goal, but not as often. Some products are injectable treatments at home, for example Forteo, which is usually only used if the osteoporosis is particularly severe, like in patients who have had fractures in the past. We should, however, never forget about calcium treatment and vitamin D. Specifically now we have discovered that so many people are vitamin D deficient in our society. It is really estimated that over half the population does not have enough vitamin D in their diet, and especially here in Tucson, since we're avoiding the sun, it is very, very common that I find low vitamin D levels in our practice population. So calcium and vitamin D are very important products to help you prevent and treat osteoporosis. Exercise is another example that we often don't talk enough about, and it can be so helpful in preventing and treating osteoporosis. The basic exercises such as swimming, walking, bicycling are helpful for general balance, muscle strength, and therefore a decreased likelihood of falling. Let's not forget that if you never fall, you can really not even fracture your hip. So that's the best prevention in the first place, stronger than any medication. We do not have many specific exercises yet to help you prevent diabetes, but it's really believed that exercises such as weights, muscle strengthening exercises such as resistance training or impact aerobics are the most helpful types to strengthen the bones. Let me talk for a minute more about exercise to help you prevent or treat osteoporosis. We know that certain exercises are good in general for your general health, such as bicycling, walking, and swimming. They do help osteoporosis in a way that they help you prevent you to fall and stay agile. And if you fall, to protect your fall better. So they're still helpful. But specific exercise to make your bones stronger need to consist, we think, of weight training, resistance training, or impact aerobics. In terms of follow-up of osteoporosis treatment, we usually recommend doing a bone density test every 1 or 2 years, as well as blood tests to follow your vitamin D levels and to follow if the treatment is working. We also want to examine you and make sure there have been no recent fractures and take a general history and physical each time you come in, usually on an annual or every 2-year basis.